Good morning. My name is Tima Davis, and the topic of my project was herpes simplex virus, taught through the oral pathology course DHG 240 here at Fortis College. And here is just a list of the learning objectives that we're going to discuss. We're going to define herpes simplex virus. We're going to talk about the history, the etiology. We're going to determine the appearance on the skin, determine the types of treatment, and dental aspects for providing care. So what is herpes simplex virus? Herpes simplex virus is a contagious infection characterized by two types. So the first type is HSV1, a virus acquired usually in or around the oral cavity, appearing as painful blisters or ulcers at the site of infection. And then you have HSV2, a sexual transmitted virus through skin contact of the genitals, open sores, and fluids of an infected individual. And here's just some historic facts. So believe it or not, herpes developed from the Greek term to creep or crawl, and described the breakout of the herpetic skin lesion about 2,000 years ago during the early Greek civilization. And I also found out even Shakespeare was familiarized with this virus. He actually added it to one of his quotes in the Romeo and Juliet scenes. I am not going to try to attempt to say the quote because those terms look a little bit difficult. Here's just the process of HSV1. So first you have the primary infection, which occurs in childhood. And then you have the epithelial cells infected. So the virus becomes latent in neurons of the peripheral system. Then you have the lifelong occurrence. So it can be periodically activated, causing recurrent episodes. Here's just a list of possible triggers. So it can be triggered by stress, fever, extensive exposure to sunlight, surgery, or physical injury. So host-related factors consist of, one can be genetics. So the virus can be passed to offspring hereditarily. Another factor can be immune response. Weak immunity allows virus to attack the body and destroy cells. And then of course, sexual activity. Once infected, kissing or any intimate relation should be avoided to stop the spread. Here is just some signs and symptoms. For HSV1, you can have burning, tingling, itching, fluid-filled blisters forming on the face and tongue or lips. For HSV2, sometimes no symptoms, itching or pain around the genitals, burning when urinating, or sores near the genitals. And so here is just an image of a personal situation. Okay, honestly, this is an image of my daughter, Jada. She had this condition starting around the age of 8 years old, and we had no idea what her condition was. And so we treated it by just Blistex or using Vaseline on her lips until we took her to the doctor and we found out that this was what she had, HSV1. So here's a list of treatment. For medications, you can have suppressive or intermediate therapy. You can use antiviral medications such as acyclovir or valacyclovir, anti-inflammatory agents, over-the-counter topical anesthetics, and you may also need a confirmation of diagnosis by blood test or biopsy. And some dental considerations: you always want to review the patient medical history, ask follow-up questions to determine the process of care. You want to always communicate with the dentist of the patient condition, and of course, postpone treatment until the lesions have fully healed. And here is my references. I hope you guys enjoyed my presentation.